So now we're going to actually start talking about the bones of the skeleton. And we're going to start with the skull because the skull is quite complicated. There's quite a few bones involved in the skull. And so it's going to be quite a bit of information here. So some basic skull structures you're going to need to know. A suture, which is a division between cranial bones. A fontanelle, which is a membrane-covered spot where the cranial bones have yet to grow together. This is specifically found on infants most often. It's also called a soft spot, where there is no bone covering. It's just soft tissue. The bones are eventually going to fuse together, and we're going to talk about that later. A process. So this is a slender projection off of a bone. And then we have a foramen, which is a hole in the bone. Now, many of the bones of the skull share names with the lobes of the brain. So that's why I threw this picture in here, because these names that we learned way back in our nervous system unit are going to show up again. So here we have an anterior view, and you'll notice on your notes that I have several specific terms that you need to label, and they have letters next to them. So the lines that have letters are the ones that you need to label, because the pictures are slightly different. So just make sure you're aware to track lines, and so that you know which ones you need to label. The reason I'm not having you label all of these bones is that we get better visuals on certain bones in different views. So these are all the ones that we get really good views on from this direction. So we're going to just label the ones that we get really good views on here. So now moving on to the lateral view, again, you're just labeling the things that are asked for by letters. And one thing I will draw your attention to is this cluster right down here. These are all bone markings. You can see the external auditory meatus. That's what you think of as the ear canal. So that's why that's there. The mastoid process is a huge part of chewing. It's what the large muscle of the jaw attaches to, so I wanted to make sure we drew attention to that. And then the styloid process is another muscle attachment, and I just wanted to make sure that we had that information. So here's the inferior view. I do ask for the maxilla a second time. That's because I want you to see the maxilla and the palatine together. Those are what make the hard palate. So just so you're aware, I wanted you to make sure you understood what are the two components of the hard palate. The underside of the maxilla is one, and then the other is the palatine bone. And then looking inside, you do not have this picture in your notes, but the reason I gave this to you was so that you could see where some of these depressions let in. So you can see many different holes here. Again, remember that depressions are to allow nerves or blood vessels to enter into a bone. And this is particularly important in the skull because your brain is sitting in there, and we're going to need nerves to run in and out of there, obviously. And we're also going to need blood vessels to run in and out of there so that they can supply the brain with blood. And then we have the superior view. This you do have in your notes, and the reason for that is because this is where you're going to label the sutures. So the sutures, remember, are divisions between bones, and these are where the bones fused. And so they are these jagged lines as the bones grew in together. So starting here, we have the coronal suture. This is the one that attaches the frontal bone to the two parietal bones, and it runs over the top of the skull, right at the back of the frontal bone. Then we have the sagittal suture. This connects both sides of the parietal bones. So we have two parietal bones, and those get fused through the sagittal suture. Then we have the lambdoid suture, which connects the occipital bone to the parietal bones, and you can see that one there right at the base of the skull. Now, there are two places on the skull where we have three sutures meeting in one point. So we have the two sides of the lambdoid and the back of the sagittal suture all meeting here at lambda. And then we have the two sides of the coronal suture and the sagittal suture's front end here meeting at bregma. So bregma is at the front, lambda is at the back. They're in alphabetical order. That's the best way I can help you to remember that. Lambda is also the one that is on the lambdoid suture. So they share a name essentially. Just ways to help you remember that. So let's talk a little bit about fetal skull development and like what the skull looks like at birth. So the bones of the skull are not fused at birth. This is to allow them to have a little bit of adjustment as they pass through the birth canal. In fact, the skull can actually be squeezed during birth and actually compress due to contractions. And the bones will settle back down into their natural place after birth, but that can take a couple of days. And so you might see babies born through vaginal births that have almost like pointy heads as the bones were compressed during birth. So those sutures form because infant bones are not fused. And so we also can talk about fontanelles, and those fontanelles are soft spots. So you can see those two sides have not fused fully. And so we have this spot right here, and we have several other soft spots where, again, it's just to allow the bones to shift. They don't remain as the infant develops. Those are going to close and will fuse. Sorry about that. So let's talk a little bit about skull shaping. Skull shaping is a practice by which we take like leather straps or cloth straps and wrap them around the skull of an infant to shape the skull into a desired shape. It's usually this elongated oval shape. This is usually the shape that happens. This is a practice that has been practiced on every continent where humans naturally live. There are societies all over the world that have practiced skull shaping at different points in time. And just different cultures have dropped this practice at different stages. And so this is part of one of the things that we will talk about throughout looking at the different bones of the body. We'll talk about how humans adjust their skeletons because we are one of the few animals that actually do that. We actually adjust our skeletons. And so I want to highlight those when the case arises. And skull shaping and any like skeletal modifications that we talk about really revolve around beauty standards and what is considered desirable. Oftentimes, these things represent cultural significance. In the case of skull shaping, in cultures where this is still practiced, it can be a situation where only like religious leaders can have their skull shaped. So if a baby is born and it is determined that they are going to become a religious leader in this culture, they'll have their skull shaped, and that those are the only people who can. It can also indicate status, so it can also be situations where what we would almost call nobility or the upper class have their skull shaped, and they are the only people who can do that. So there's a lot of meaning that can be wrapped up into these practices, and it's just a really interesting thing that humans do, and just an interesting thing that is only available to us because of the fact that we are born with our skulls not fused, and we have some play in our skulls that allow us to shape them like this. Cleft palate. This is a disorder where the maxilla and the palatine bone don't fuse. They don't actually become a solid surface. This means that you are left with a depression in the roof of your mouth. So like if you take your tongue and you kind of follow the line of your hard palate back, you can kind of feel that smooth surface. Now, it's not that like anyone who has a cleft palate can like stick their tongue up into their nose or their brain. It just feels like a soft space. And the reason cleft palate is so troubling is that it actually prevents you from swallowing. Your tongue and your hard palate are essential for actually swallowing any food. When you swallow, you press your tongue up against your hard palate in order to shape whatever you're swallowing. And anyone who has cleft palate, they can't get a good seal, and they can't shape the food to actually go down the esophagus, and it can lead to malnutrition because they simply cannot eat. We have a very ethical and like really efficient surgery that can correct cleft palate. And it is so important to like get treatment for cleft palate, particularly in infants, so that like they can actually swallow and get the nutrition they need. Moving on to the hyoid bone. This is not technically part of the skull, but it doesn't really fit in anywhere. The hyoid bone sits right underneath the jaw. It is where your tongue attaches, so it provides bone support for the base of your tongue. It also allows for your pharynx and your larynx to attach, and it sits out from the spine. So this is a top down. So like if you could like take someone's jaw off and then look down, this is what it would look like. It normally sits like this, and then it just has some ligaments that kind of hold it against the that kind of like superficially attach it to the spine and also to the jaw, of course. And so it's just kind of free floating, rather than like being in line with any other bones. Then we have the sinuses. So these, remember, are open pockets inside of the skull. These are really important because they reduce the amount of weight that our skull actually takes up and allows it to be actually supported on our vertebral column. So these are really important. They are mucus lined, so that's why you could see like pressure, because they do have openings in and out of here, but they are fully encased in bone. And then we have some problems that we can have in the sinus. We can have sinusitis, which is inflammation of the sinuses. This is where they would fill with mucus, and they can actually start putting pressure on the bone. This can be kind of painful because they're pushing against all of that bone tissue, and it can be quite painful. Also, you can have a deviated septum. So the nasal bone stops relatively high up, and then you have a cartilage extension off the end of the nasal bone to create the nose. And a deviated septum is where the central portion of the nose that separates the two nostrils is shifted to one side. So as you could kind of feel your nose, you can feel that cartilaginous part of your nose, and you can feel that center support. That's the septum. And a deviated septum just means that it is off center, and it can block one nostril or the other. It can, in fact, sometimes be both. You can have it completely at an angle where like the front of the septum blocks one nostril, and then the back of the septum, right where it attaches to the nasal bone, blocks the other nostril. So that individual cannot breathe through their nose at all. Usually, however, the septum is off to one side. It usually isn't like canted over like that. And so usually when we're talking about partial or complete, we're talking about one nostril. Is that nostril partially blocked by the septum or completely blocked by the septum? And that can, because your sinuses are closely tied to your nasal passages, that's why it's brought up here. And that's going to round out our discussion of the skull.